Hi, today I'll be talking about self-management in diabetes, which is a multi-stakeholder study. What it means is that it's a study that looks into the perspectives of patients, their caregivers, and physicians. This study is the summation or the overall conclusion of the work that was done by Ms. Subha Gomathy, who is my senior PhD student at the Department of Liberal Arts in IIT Hyderabad. So what I'm going to be presenting today is the work that I will be presenting in Lucknow at the RSSI-DI. So let's begin. So let's start with a very brief background to self-management. Self-management refers to an individual's ability or capacity to exhibit certain kinds of behaviors that effectively manage the impact of having an illness on one's life. Now, effective self-management is observed to improve the patient's self-care practices, reduce reports of illness-related complications, decrease healthcare and hospitalization costs, and decrease psychological distress. Now, when it comes to diabetes self-management, it refers to the individual's capacity or ability again to adhere or to comply to most likely or most frequently their doctor's prescribed behaviors such as diet, exercise, self-monitoring of their blood glucose levels, taking their medication as per the prescription, and ensuring foot care, and also attending their regular checkups. Now, these lifestyle changes or these behavioral changes usually require the individual to exhibit very high levels of self-efficacy, self-control, and the ability to use adaptive coping techniques, and an overall high level of compliance to these doctor recommendations. Now, what's the research that's available in India? And what Subha and I had found was that the research in diabetes self-management mainly focused on developing diabetes-centered literacy or education materials and interventions that helped improve the patient's management of diabetes. Now, what was also observed was that these studies were not completely successful in actually improving this patient self-management. Now, another thing that we had observed was that there were no studies that really examined the complexities and the nuances that were involved in diabetes self-management in India. So they didn't really touch upon topics such as cultural contexts of health, illness perceptions, the role of social support, illness-related knowledge or education, and especially in terms of medical literacy and doctor-patient relationship. So when we had done a meta-ethnography and also a literature search, and this is what we had come across when it came to research within the Indian context. And what we had also observed through our literature search and meta-ethnography was that there were not enough studies looking at the qualitative experience of diabetes self-management as opposed to the enormous number of quantitative studies that looked at it. However, what was also revealed was that actually diabetes self-management is a very complex, very personal, and an extremely delicate balance between the patient, caregiver, and the physician. So that got us really interested in looking at diabetes self-management from a qualitative perspective. Now, Subha will be uploading presentations through this channel on the 4 studies that she had conducted. One, which was a meta-ethnography, which is akin to a meta-analysis, but a qualitative systematic review, if you may, that looks at the topic of diabetes self-management. She then followed it up with three individual studies that looked at diabetes self-management from the perspectives of the patient, caregiver, the patient's caregiver. So there were a dyad that were interviewed individually, though, and their physicians. And we are now at the stage, since she is a final year PhD student, we are now at the stage where we could look at the overarching themes, and this whole presentation is looking at those overarching themes. Now, so what is the aim of this presentation? Is to look at the experiences of the multiple stakeholders that were involved in the process of diabetes self-management in India. The methods that were used were what I had just described. Shubha interviewed 50 type 2 diabetes patients and their respective caregivers, as well as their physicians. And the research sites were diabetes specialty clinics in different localities and neighborhoods in Chennai, India. And I'd like to pause over here and say that we had specifically wanted to look at neighborhood clinics because we wanted to look at people who were dealing with diabetes without any extreme complications of diabetes. So people who were dealing with diabetes at a more daily basis, but at also a less severe basis, although it was chronic and eventually perhaps life-threatening. So the interviews were semi-structured, tape recorded, and transcribed. And these transcripts were translated first into English if they were in Tamil, and then they were back translated to verify for authenticity. And the interview topics were various depending on the participant group. So with patients, she had asked questions relating to the experiences of managing the illness, and also looked at what was helping and what was not helping them in terms of self-management. With the caregiver, she had asked about the attitudes towards patient diabetes, their patient's diabetes self-management, and also about how they were participating or contributing towards the patient's diabetes management, and also what was their experience as a caregiver. With the physicians, she was looking at the strategies that we use to ensure adherence on the part of the patient, and also looking at how they were experiencing communication, for example, in terms of the patient's self-management practices. We used IPA, interpretative phenomenological analysis, to understand the complex, situation or topic of diabetes self-management. Now, IPA is an iterative form of analysis, and I will be putting up a presentation that explains and describes this methodology in the coming weeks. In terms of the patient demographics, we found that the average age was 42.5, and our sample had more male than female patients, and most of them were currently married, and all of them were educated, and their monthly average income was 20,800 rupees. Their medical information was that the average or the mean time since diagnosis was more than 15 years, and their current medical treatment was mostly or more frequently tablets. And when asked whether their diabetes was under control, most of them had responded in the positive, that is, that they felt that their diabetes was under control. Now, the caregiver demographic information is that the mean age was 43 years. There were more female than male participants, which corresponds obviously to our patient sample because we had, as I had previously said, recruited dyads. And all of them were educated, and most of them were the spouse of the patient. When we looked at the physician demographic information, we found that the average age was 39 years, and there were more male than female physicians, and their years of experience was 27.4. And the number of patients that they saw in a day was 10, and they had spent what is by Indian standards an ample amount of time with each of these patients. Now, I'd like to pause here for a moment and remind you that this study was conducted in neighborhood clinics. So these physicians were all working in or employed by other hospitals and facilities, and they often would turn up at their clinics for a few hours every evening, and therefore they would have been able to spare about 10 minutes of their time they would be able to spare 15 minutes of their time for 10 patients each evening. The overarching themes of our 3 individual studies were 4, and I'll be discussing these in turn in the coming slides with some sample quotes. The first theme explored the need for socioculturally competent diabetes-specific education. And what we had observed was that all the participants were able to recognize the crucial role of diabetes-related literacy, illness beliefs, and also the financial aspects of diabetes management. Now, when we look at the quotes, you see that the understanding that Vijaya has of diabetes is that it's a headache. So it raises questions about how well do patients understand their illness? How are they comprehending their illness? Are they able to relate their symptoms appropriately? As you can see also with Ram's quote, where he was unable to relate the symptoms of diabetes to the illness. So, it talks about how crucial it is to be able to equip caregivers and patients alike with sufficient appropriate information which allows them to make effective health decisions. Also, we could see from Mani's quote that it is a very serious issue, that not knowing about their illness and therefore exhibiting low levels of medical literacy, especially diabetes literacy, and also not having appropriate accessible information about this illness really was causing them to also make perhaps inappropriate decisions in terms of adherence, and then that would have led to some type of complication. The second theme looked at the strategies that were used for self-management. What was encouraging was that patients were able to give examples of a range of techniques that they were using to self-manage, and caregivers and physicians were also able to give us methods in which they were helping or supporting self-management in the patients. So these are some quotes that illustrate this theme. The third theme explored perspectives on what was defined as adequate social support. Patients reported a need for regular social support. However, this was contradicted by both the caregivers and the physicians, who felt that patients should take responsibility for their own illness. And this led to all 3 of them feeling angry, frustrated, and helpless. So this highlights the lack of an honest, open, or clear dialogue between these stakeholders. Now, when we look at the quotes, you'd see that there was a lot of negative emotions that were communicated through these interviews, because there was a lack of communication of especially what their feelings were or what their needs were in terms of support, and also what was the caregivers or the physicians' expectations of the patient in terms of requiring or not requiring support. So I'm going to give you a moment here just to read through these quotes because some of them are particularly evocative. The fourth and the last theme explored the need for individualized self-management interventions. Shubha and I had observed that patients, caregivers, and physicians did feel the pressure to ensure self-management, but their beliefs about their individual roles or contributions towards achieving this goal of self-management were disconnected. So it emphasized the need to take into account each triad. So that means if a physician is consulting with 10 patients, then it means to look at each of these consultations individually and look at the stakeholders' concerns, expectations, the relationship between the three of them, and their diabetes related experiences while developing self management interventions. This is more clearly illustrated by the quotes that you can see on your screen right now. Now let's look at Srini's quote. I will be excluded from my community if I use insulin. Now Srini's concerns are clearly the community perceptions of insulin use, and this may or may not have led to medical non-adherence. Looking at Rita's concerns, her expectations are that the doctor and the patient should together look into monitoring of blood glucose levels in the patient. And her concerns are that she is juggling both work and home, which includes the husband and the children, and may not have the time to pay attention to monitoring of blood glucose levels. Then when we look at the physician's quotes, for example, Nitin's quote, patients will adhere only when there is a strict policy to ban all the junk foods and promote community gyms, even in rural parts of India. Now this is disconnected because the needs or the requirements or concerns or expectations of patients and caregivers are more socioculturally driven. However, Nitin's solution of having community gyms may or may not be very feasible, especially because there is research that looks at the gym usage among females in urbanized locations. So then what is the feasibility of community gyms if there are not optimal number of females using gyms in urbanized locations? And also the question of what about diabetes related education rather than the unrealistic ban on all junk foods? Now, looking at, say, Balu's quote, many a times caregivers do not know about diabetes and they do not allow their patient to take medicine on a regular basis. I think they need to be given education about diabetes. Now, this could be very well Balu's individual experience with patients and caregivers, which needs to be taken into account when developing self-management interventions to unpack whether this is all caregivers or some caregivers. And that's where the need and the importance of individualizing self-management interventions kicks in. Now, to conclude our findings and have a little bit of a discussion about it and also talk about the implications, first of all, it's very encouraging to know that patients, caregivers, and physicians have been able to identify and use strategies to maintain successful self-management. However, we observe that there's a need for providing diabetes-related education that is tailor-made for each patient and respective caregiver, but also includes training physicians in the skills to deliver diabetes information that is individualized and therefore dynamic. We also observed the important role of effective communication, especially in terms of roles and expectations between the three stakeholders in order to encourage optimal self management of diabetes. So, as you had seen in some of the themes, we found that there was this disconnect between the three stakeholders, and also that there was a lack of clarity in terms of what, say, for example, social support is. So, having effective communication between the patient, caregiver, and physician may lead to more optimal or improved self management of diabetes. Now, future research needs to include these unique sociocultural and economic aspects of diabetes. Say, for example, doctor patient relationship, financial management, the role of the caregivers, what are the lay definitions of health? These things are important concepts that need to be included when developing, designing, implementing self management interventions in India. Thank you very much for listening to our presentation. If you have any feedback, queries, comments, please feel free to get in touch with me or Subha. I'd like to also highlight over here that Subha Gomathy is the principal investigator on this study, so she would perhaps be better equipped at answering any kind of queries, especially when it comes to data collection and her personal experiences during data collection. Also, I'd like to pause over here and thank Shubha for all the hard work she's put in the past couple of years. And hold your horses and be excited for her upcoming presentations on metaethnography and the individual presentations on her findings in terms of the patient, caregiver, and physician interviews. Happy weekend, everyone!